Dally. I am your nurse today. I just got here and got shift report. They said you're not feeling very good, had some pneumonia. We will do good to take care of you here. Like I said, my name's Dally. Can I have you tell me your first and last name? Let me find your band. Okay, Mona Hernandez. And when's your birthday? Okay, perfect. That matches what we have. I shut the door for privacy so no one will interrupt us in here. The doctor just has a list of things he would like us to get done. I'll start by just doing an assessment of you to make sure that you're still doing okay with healing and everything. And then I heard that you're in a little bit of pain, so I'll get some medications to you and your high blood pressure medication. And then you have had some urinary retention, so I will insert a catheter last. Just let me know if you have any questions or anything as we go, and I'll do my best to make it quick and painless for you. Just stitch it up a little. I'm just gonna put some hand sanitizer on, and then I'll start with your assessment. Did you sleep good last night? Good. Okay. Just gonna have you sit up a little. I'm just gonna feel your head a little bit. Make sure there's nothing wrong. Under your eyes. Okay, nothing wrong with that. Are you in any pain today? Just a little bit. And what are the characteristics of your pain? And the onset? This couple hours? Where does it hurt? Just a headache? And you said just a few hours for the duration. What makes it better? What makes it worse? What exacerbates it? Move it around. Okay. Have you had any relief from it? Not yet. Well, we will get you your medications. Has it radiated anywhere, or does it just stay in your head? Okay, perfect. And then do you have any other symptoms or anything going on? Okay, well, I've got your medication, so we'll do that as soon as we're done. I'm just gonna have you close your eyes for a minute and then open them. Okay, pupils are pearless. They're equal reactive, responsive and reactive to light and accommodation. I'll just have you open your mouth. Okay, and I'll check your ears. Ears look great. Okay, and it says you're alert and oriented, so that is good news. Can I just check your wrists, your hands? Okay, check for trigger and color. Everything looks good. Capillary reflexes are great. You squeeze my fingers. Okay, perfect. And I'm just gonna check your chest, make sure that everything looks good. Okay, there's no discoloration or anything. Have you had any other troubles today you want to tell me about? Perfect. I'm just going to listen to your heart. I'll listen in 5 different places. The last spot I will listen for a full minute, so it might take just a minute, and I'll just check your pulse and everything, or your heart rate, and make sure it's right with your pulse. Okay. So there's your aortic. Your pulmonic. I'll go to Erb's point. Your tricuspid. And then your mitral. Almost done. Alright, your heart is strong and healthy. It was beating about 78 beats per minute, which matches the vital signs that the aide took this morning. I also needed to have you follow my pin. So can you just go over here? Okay. Up and down. And then in. Okay, perfect. Alright, next I'm going to listen to your lungs. I've heard that you had pneumonia, so they're not doing too good. We'll just listen and see what we need to do for that. Listen in 6 spots in the front and 6 in the back. You just take deep breaths every time I place the stethoscope. So take a deep breath. Deep breath. Deep breath. Deep breath. Then I'll just go under your breast. Okay, and one more deep breath. Alright, and I'm going to have you sit up so I can listen to the back. You lost your hair. Okay, deep breath. And again. 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 And then 2 more at the bottom. Okay. Fix your hair up. They are still sounding a little like you're underwater, so we'll keep the prescriptions coming for those. They said you've been having some bladder retention. When is the last time that you peed? Oh, not since yesterday afternoon. Yeah, we will definitely place a catheter to make sure that we get you all drained and more comfortable. When is the last time you had a bowel movement? Last night. And how often do you usually have them? Okay, that's normal for you. So I'm just going to lift up your gown and I'm going to listen to your stomach, your bowel sounds for just a minute. Try to keep you covered as good as we can. And I listen for a full minute in each spot, but I won't hear anything today. Listen here. Okay, everything sounds good down there. If this was a mannequin, I would have her get up and walk around to assess her gait. And they said she's been doing well with her walker, so I'll take that. Okay, I'm just going to check your pedal pulses. Just have you relax. Okay, they're strong and equal. Okay, I'm going to have you push my hands down. Okay, and then pull your feet forward. Okay, everything looks good there. I'm just going to check your radial pulses. Make sure that they are equal. Alright, everything looks good there. Do you have any questions before I give you your medication? Okay. Looks like you've had a good meal, apple juice, chicken broth, and a popsicle. Alright, so we're going to start with your lisinopril. So we'll look in your MAR. So lisinopril. Alright, so you get it in the morning, so I'll give it to you right now. Alright. So this is for lisinopril, 12.5 milligrams by mouth. Okay, and that's exactly what this is, so we'll just do 1 pill. Can I just have you tell me your name again? Okay, and your date of birth. Perfect. Matches what we have. And this is the right time in the morning, the right dosage, orally. And so we will get that administered. You can open it. Okay. Set. I'm just gonna scan the patient. Okay, so I've done my first check. Once again, I'm just gonna check. This is lisinopril, 12.5 milligrams by mouth in the mornings. And this is the right patient, Mona Hernandez. And yeah. Okay, then before I do it again, I would check one more time. So I'm just gonna have you take this pill. And here's a little bit of apple juice, take it with it. Okay. Okay, and then I know you had a headache, is that right? Okay, so let's get some ibuprofen for you. Sorry, my computer's slow. Alright, so ibuprofen. They're hard to open. Okay, well I would have someone else come open this for me since I can't get it open. And then I would give her, this calls for 600 milligrams. And these are 200 milligram tablets. So I would give her 3 of these little tablets. And again, it's orally and PRN, so just when she has a headache. So I will scan medication. Okay, and then I check again. So this is ibuprofen, 200 milligrams. So I need 3 pills to equal the 600. This is the correct patient. I've been in her room. And it's the right route orally, and the time is PRN, so why she needs it. So we are all set there. I would do that 3 times. So then I would give her her medication and follow it up with some water. Make sure she gets it down. Everything looks good. Okay, and then it said that you had a cough. Do you want something for that right now? Yes, okay. Alright, so I've got some guafenicin for your cough that I can give you. Okay, and this is a liquid form, and she'll take it orally. Again, it's PRN. She needs 100 milligrams, so 100 milligrams per 5 milliliters, so she will get 5 mLs. Okay. Put this here for her. Again, there's 5 milliliters. this is the correct dose of 5 milliliters because she needs 100 milligrams. It's the right time, PRN, right route, orally, it's the right patient and the right medication. I've checked multiple times. So we'll administer this to her. Okay, this might have a bitter taste. And you just swallow it and it should help with your cough. And then I could give her something else to keep it down with. Okay, are there any other things that you would like to talk about before we do your catheter? Okay. Just make sure to get all my stuff ready so it goes as smooth as possible while we do this. Move all this stuff around so we have enough space. Put hand sanitizer on. Put some gloves. I'm just going to wipe down this table to keep everything as clean as possible. Okay, I'm just going to raise the bed up. If you're uncomfortable for any reason, just let me know. I'm going to lay you back. Okay, again, this is a little bit of an invasive procedure, so I'm going to have to pull down your gown, but I'll keep you covered as best as I can. Let me just grab my wipes. Looks like someone else threw the other kind away, so I'm just going to have to use these. Okay, I'm going to have you spread your legs. I'm going to put this blue pad down. Okay, and I'll just have you lift your hips to help me out a little. Great job. From cleanest to dirtiest. Start right down the middle. Do this side. This side. Down this side again. And then one more. Alright, you are all cleaned off. So I'm just going to get my other stuff ready. I'm going to put this down so I don't accidentally hit it. Hand sanitizer one more time. Okay, I'm going to put this between your legs just for another trash spot. Just a reminder, don't move your legs or try to hold as still as you can, just so that this stays clean and everything goes well. Do my best to keep this sterile. then I'm going to use these other gloves just because they fit better. So I'll put these on sterilely. I'm going to start with the right hand. Move this down. Honestly, the other. So I don't need these. Open this up, make sure it stays plain. And I just place it right between her legs. Okay. Place this right over you. So once again, just hold very, very still. Set these on my sterile field. I just get all my supplies ready here. Okay, everything is set up there. Alright, I'm going to be very careful to keep sterile filled. I'm actually going to bring this over first. Make sure I don't touch anything. And then this hand will no longer be sterile. So I'm going to spread her labia. And I'm going to clean again. So go top to bottom. And I'll do both sides. Alright, this is going to be a little bit uncomfortable. If you need me to stop, just let me know, but I'll try to be as quick as I can. Okay, take a deep breath. Okay. Alright, it's in. I'm just going to inflate it. good right there. So now I am no longer sterile because everything is in. It went smoothly. So I take this out and I would attach it to her leg. And then I will check the bag to make sure that the drainage clamp is closed and that the urine is drained nicely. And hang it on a spot that will not move. And it's under here. Everything looks good. So I just clean up my stuff and get the cover back up. Are you feeling okay? You did great. Good. So we'll just watch that to make sure everything is draining well. And I'll go back in. If you notice anything that's out of the ordinary, just let me know and I will come check it. And then I will also initial this and put the date on the bag so everybody knows. Okay, get your cover back up. Alright, would you like to sit up a little bit? Okay. Put your head up. Put the bed back down. That's good, okay. Alright, Mona, I'll be back in and check you in just a little bit. I'm just gonna go chart, but your call light is right here. And I'll get your water and everything, and just let me know if you have any questions.
Done?
Yeah.